Hi, I'm Dr. Rupa Juthani, and I'm the Director of Endoscopic Skull-Based Surgery here at Valley. I'm looking forward to answering some questions from the community about pituitary surgery. First question, what signs and symptoms lead to a diagnosis of a pituitary tumor or adenoma? Great question. One of the most common ways that patients discover they have a pituitary adenoma is by having some changes in their vision. You may think that you have blurry vision or you just can't see quite right, and when you go to the ophthalmologist, they tell you there's nothing really wrong with your eyes, but it may be that there's a problem with the nerve. Pituitary tumors, when they grow, can actually press on the eye nerves, and when they press on those eye nerves, you can get blind spots in your vision. In addition, patients can have problems with their hormones. The pituitary gland is the main hormone-producing gland of the body. If there are any issues with the pituitary gland, you can get either too little hormone or too much hormone. Oftentimes, your primary care doctor or even your gynecologist or, in fact, your endocrinologist might pick up on this and let us know that there might be a problem that is originating in the brain. Question 2. In what conditions can you perform endoscopic pituitary surgery as a treatment option? Another great question. So let's start by first talking about what endoscopic surgery is. Endoscopic surgery is surgery where we use a tiny camera and utilize the body's natural openings in order to remove tumors or repair things. In endoscopic pituitary surgery, we actually use a tiny camera and we go through the nose all the way back through the air cells to the base of the brain, which is where the pituitary gland sits. The wonderful thing about endoscopic surgery and endoscopic pituitary surgery is this gives us an enormous wide-angle view of all of the important structures at the base of the skull, including the pituitary gland. In contrast to other types of surgery, such as surgery where we make big incisions to go through and around the brain to get to the pituitary gland, in this type of surgery, we're actually going directly to the tumor without manipulating the normal brain. That has many advantages, including no incisions and decreased length of stay. So we're really excited to be able to offer this type of surgery at Valley. So who then is a candidate for endoscopic pituitary surgery? Most pituitary tumors can best be treated with endoscopic surgery. There are very few tumors that are in or around the pituitary gland that cannot be treated with an endoscopic approach. There are some tumors that live near the pituitary gland but aren't actually pituitary tumors that may best be treated by either another approach or maybe even a combination where we do some endoscopic surgery and then combine it with another way to treat the tumor or cyst. Question 3, do all pituitary tumors need to be surgically removed? Not all tumors need to be removed. In most cases, for tumors that are under 1 centimeter in size, we don't have to remove them at all. The only times that we do remove small tumors are when they are causing too much hormone or if they have an unusual location or they bleed and they cause problems as a result of that. But for the most part, small tumors, we just watch over time and we don't usually treat them until they grow or are causing a problem. Larger tumors in healthier patients, we do prefer to operate on in order to prevent problems with vision and with hormones. What is the criteria for a pituitary tumor removal versus other treatment options? In tumors that are in the pituitary gland, we remove them if they're causing vision problems, if they're big enough or close enough to the vision structures where we worry about vision problems, or if they're causing hormone problems. Any of these reasons are reasons to remove tumors. In most cases, we do prefer to remove these tumors because they're benign and they can be cured with surgery. In some cases, tumors can actually be treated with medications instead. There's one tumor called a prolactinoma, which is a pituitary tumor that produces high levels of prolactin, which is the milk-inducing hormone in the body, and that tumor actually responds really well to medication. So one of the first things we do as surgeons is we check for patients with pituitary tumors to make sure they don't have that medication-responsive type of tumor. For most of the other tumors, unfortunately, there are no good medication options. For patients who are good candidates for surgery, surgery is always the best option. For patients who may not be a good candidate for surgery or perhaps have already had a surgery and now we're having new tumor forming, we have other options. That includes things that we do right here at Valley, such as gamma knife radiosurgery, which is a highly focused form of radiation with surgical precision that allows us to target tumors without hurting the important structures around these tumors. There are also exciting new clinical trials for some complicated tumors that are a little bit more aggressive that people may be a candidate for. Fortunately, for a majority of pituitary tumors, these are benign tumors that can be cured with surgery and controlled with focused radiation. What are some of the technological advances that are coming down the pike for endoscopic pituitary surgery? So one of the most exciting things about endoscopic surgery is that this field is just evolving so rapidly, particularly in the last decade. And we continue to have new and exciting scopes and ways to visualize the tumor that allow us to only increase the safety and the amazing ability to remove these tumors. One of the exciting things that I look for are ways to look at the tumor and separate out the tumor from the normal pituitary gland. There are unique dyes and unique agents that are allowing us to actually look at the tumor and make it fluoresce. That way we can separate out what is tumor and what is normal hormone gland. That really helps us to protect your hormone function and also ensure that we're removing as much tumor as possible. One of the exciting technologies that we're already using here at Valley is the use of the ultrasound in pituitary surgery. So we use an advanced, specialized ultrasound that is designed to go through the nose in order to make sure that there's no tumor left after we remove it. This helps us to remove as much tumor as possible and also to protect the normal hormone gland. In addition, Valley Hospital, in our new hospital, is opening up a brand new intraoperative MRI machine. What that means is that when we remove the tumors, we can actually use the MRI to make sure that we remove every piece of it. That ensures you get the best result and patients hopefully can get a cure with a single surgery. Is there any contraindication for endoscopic pituitary surgery? So there are some contraindications for endoscopic pituitary surgery. Most of those have to do with where exactly the tumor is in comparison to the normal pituitary gland or the important structures around it. Sometimes, if the tumors are too much in an area that we can't reach, too far to the side or too far back, then endoscopic pituitary surgery may not be the best option. The second part of this question is there anything that would disqualify a patient from undergoing this procedure? Again, most of the things that would disqualify a patient have less to do with the patient and more to do with where the tumor is. We always make sure that the approach we use for every tumor offers the best ability to remove the tumor as safely as possible. For tumors that are in locations that are too hard to reach through the nose with an endoscopic surgery, we might choose to approach it in a different way. Patients that are not good surgical candidates for any reason also may not be a good candidate for endoscopic pituitary surgery, and then we might consider alternative options such as radiosurgery and gamma knife radiosurgery. For any more questions, or if you're looking for more information about pituitary surgery, please make sure you go to our website where you can find detailed information about the types of surgeries we do, other types of treatments, and all of the wonderful resources we have here at Valley.